Some of the principles that, again, I was saying can be applicable to whatever educational intervention you're doing. It doesn't need to be around CRPS. It can be in the rehabilitation field, in the physio field, but it can be elsewhere also. Learning is a process that is actively constructing knowledge. So it is the active process of constructing knowledge rather than receiving as a passive recipient. Learners construct knowledge and make it meaningful in terms of prior knowledge and experiences. So for some of the patients that we're going to be seeing, it may, the learning, the education process and the learning process, it would be about breaking some prior knowledge, some of them challenging some prior knowledge, some prior experiences about how they cope with pain, how they understood pain. Some of them, it may be like building on some previous experiences. We're talking about some skills that the patient have had prior developing chronic pain that can be useful now. Learning is enhanced when it talks in a social and collaborative approach. The learning happens on the interaction between the therapist and patient rather than is a passive pass of information between the therapist and the patient. Learning needs to continue to be learning as an integrated whole. So this is not learning, doesn't happen in isolation, doesn't happen in that session. It's a continuous process that can be enriched by other experiences that the patient has. Learners must see themselves as capable and successful. We have to encourage the people that we're treating to view that they can learn some skills, that they can help them. So that is an empowering process. Learners have different ways of knowing and representing knowledge, and that's really important. For some people, it may be displaying that knowledge that they have. It can be that they behave differently. Some of them, they plan things differently, they look at their life differently, and we have to acknowledge the difference between patients. And reflection is an integral part of learning. So whatever the patient has learned, they need to reflect upon it. They need to reflect upon how this is impacting their life, how this is impacting their coping strategies, etc., etc.